Hi. So we're back again in this series on looking at mental health conditions, and I thought it would be helpful to do a little session on personality disorders. And I'm going to keep it fairly simple and general. If you look online and Google personality disorders, you'll find that there's a whole load of different names that you can find for different personality disorders and diagnoses, with slightly different characteristics in each one. Um, I don't think it's helpful for me to go into all that detail on this little talk because you can research that and look that up. But I wanted to just give a general look at personality disorders. I think the name to start with fundamentally brings up a lot of emotion, and I can completely understand that. And I struggle with the label, and I think in fact actually psychiatric organisations are thinking about the labelling and the name that's given to the group of symptoms that form different personality disorders, because it sounds almost like there's a fundamental problem with the person, there's a problem with their personality and therefore with them. And that's absolutely not the case. I thought it might be helpful actually to read from the dictionary what personality and disorder mean, because I think it helps us when we're thinking about this. So a personality, according to the Oxford Dictionary, would be the combination of characteristics or qualities that form an individual's distinctive character. So characteristics or qualities that form their character. And I suppose it's those combination of characteristics that make each person unique. And then disorder, there's lots of things that you could say are disorders, but in terms of medically, a disorder is an illness that causes a part of the body to stop functioning correctly. And a disorder could be defined as a set of problems which result in significant difficulty, distress, impairment, or suffering in a person's daily life. And so I think if we're using those definitions, that's helpful, because in a way that does summarise what it can be like in personality disorders for people. There's often a lot of suffering, there's often significant difficulty, distress, real difficulty functioning in daily life because of the issues. And if we're thinking about the things that form someone's character, um, then you can see why people have put personality disorder together. Because often in personality disorder, so particularly borderline personality disorder (BPD) or emotionally unstable personality disorder (EUPD), which is a sort of similar, different names, a similar thing. Then there are often many things around emotions, relationships, that make for great distress for that person and difficulty for that person. I find that again the Mind website is helpful. I think they have some really helpful information on there, and also people's stories of how they've got help. So that's a really useful resource to look at if you think that this might be something that's affecting you. The NHS websites are helpful as well. Yeah, they're probably the best two, I think, to start with if you're wanting to do a little bit of research and find out a bit more. So in personality disorder, it's often something that becomes evident in young people. So in my work with university students, I saw quite a number of students each year who had some of the symptoms that we could put together to say this looks like a personality disorder. And often those things become more evident in young adults. It's often less of an issue that we see in older people, I think, because often maybe people have learnt how to manage the difficulties. So often affecting young adults, sort of 18 onwards, and can cause amazing distress, really unpleasant distress. So typically, presentation for the students that I would see would be things around difficulty with extreme emotions, particularly sudden changes in emotions, often within minutes. So going from feeling very high to very low, to feeling angry, to feeling to feeling elated, but not long periods of time for each emotion. These emotions changing very quickly. there'd often be problems around feeling abandoned or not really knowing who they were, maybe feeling that they weren't inhabiting their body properly, they didn't really know who they were, or they felt that they were different in different situations and with different people. And it can be difficult to have a real sense of self and value and worth as a person, because it's difficult to know who you really are. So relationship with yourself, I suppose you could put that as, is often a significant problem. And then relationships with other people. So often those relationships can be very, very intense, or they can be very, very difficult, and they can swing from one extreme to another. Often a feeling of great distress if a relationship breaks down, excessive distress beyond what you'd expect in that relationship, and difficulty forming relationships that seem normal. There's often extremes of things, so extreme intensity in a relationship, extreme distress when the relationship breaks, and people in relationship with people with personality disorders can find it difficult because there's a demand on that relationship that can seem excessive and difficult to know how to manage. Because of these things going on, often there are problems around self-harming, a feeling of wanting to do something to punish yourself or express something, and that often shows itself in self-harm in some sort of way. There are other things that can come in, but I think that probably covers the main areas that we tend to see. And these things can make life really, really difficult to manage. Which I'm sure you can see. If in a day you've got these swinging emotions that are really, really extreme, if you don't really know who you are or where you are on that day, and if relationships with other people are very, very difficult and you've got thoughts of harm, that's a difficult combination of things to be managing all the time. Now, personality disorder is called disorder. It's a disorder for a reason. So it's not actually a disease process. So in some things, we know that there's some disease process that is going on in the body. There are many, many medical conditions where a group of symptoms are put together. So you could say irritable bowel syndrome is a combination of symptoms that it's sort of descriptive. There are lots of things that are descriptive based on the symptoms, and personality disorder is one of those things. And I think that's partly why it can be really difficult to know whether that's a helpful diagnosis or not. And I think amongst my patients, there's a mixture. So some people find it really, really helpful to have a label. Some people find it really helpful to be able to tell other people what the label is, because it helps explain why they're struggling as they are. So for some patients, referral to mental health services, and in the UK the diagnosis has to be made by a psychiatrist. It's not something that we can make the diagnosis in general practice, although we can suspect. So actually referring to psychiatry and actually getting a diagnosis for some people is really useful. For other people, they find that quite offensive because it's actually labelling something that they see as being a response to normal or to difficult circumstances. It's not a disease. And so the label for some people is actually really off-putting and unhelpful. And I think we have to be sensitive to that with people. And maybe the most important thing is thinking, okay, there's this combination of things that have happened for that person for a number of reasons, some of which we may not know. Maybe a better way of looking at it is to think, how can we practically help that person with those difficulties, rather than relying on a label. So for some it helps, for some it doesn't. The other thing that I think I would say is that there are a number of reasons why personality disorder can happen and in a person, and often, if you read about this, if you look on the Mind website or NHS websites, you'll see that often there are things that have happened in that person's childhood, in their background, that have been really, really difficult to handle. So there may have been abuse, there may have been neglect, there may have been really difficult home situations, difficult relationships with people, trauma that's happened in some sort of way. And And there may have been other people in the family who were struggling as well. And whether that's genetic or whether that's because that kind of behaviour was modelled is difficult to know for certain. But generally, it's felt that there's been a combination of things that have happened for that person that have meant that they had to develop ways of survival, ways of managing life on a day-to-day basis. And so some of those emotional things, some of those relational things have developed because they had to in a difficult situation. And at the time that was fine. At the time that was the best. That was a good thing because it enabled them to survive. It enabled them to get by in that situation. But into adulthood, and this applies for lots of things in our lives, the things that applied in childhood don't apply so well anymore. So the behaviours that worked when we were a child in a situation, in an adult situation at university or in work or whatever, now that doesn't work so well. But we haven't been able to develop other ways. We haven't been able to work through that and develop other ways of managing that are more healthy and more beneficial for us and for the people around us. So if we're thinking about how to help, if you think you've got a personality disorder, or if you've had a diagnosis, or you've got a friend who seems to show some of those traits, I think the first thing is just to talk to them, just be open, just talk to yourself, just do a bit of research, maybe look on the Mind website and look through the information on there and have a think about it. It's really helpful as well to think about your story, think about what happened in your life, a bit like I've talked about before, looking through childhood, the people that were there, the situations, what was difficult, how did you learn to deal with that at the time, what are the patterns that you see going on in your life, what are the triggers. And then it would be really helpful to talk to somebody about that. And it may well be that that's your GP. It may be that there's a nurse practitioner in the practice that you can talk to. It may be that accessing something like IAPT, the Improving Access to Psychological Therapies, is a starting point for you. But talk to someone, even if it's a close friend, trusted friend, or a family member who's a little bit detached, who you feel safe with. It's good to talk to somebody. And start to look at what can be helpful for you. Now, there's help on different levels. So some help is really, really practical. It's things like starting to identify what some of the triggers are. So, for example, if you know that when it's exam time and there's pressure from other places, or if you know that in certain social situations you find it really difficult, or if you know that there are some people involved in your life it's really difficult to be with, and that you're worse in those situations, then really practical things can be helpful. So for example, if you know that it's a bad day today and all these things are coming up, having a sort of first aid kit, I suppose, a mental health first aid kit, can be useful. And that's something that you've prepared in advance. So it might be that you have a friend that you text, it might be you have some music you put on, it might be you have some something that's creative or craft that you do. It may be that you have your trainers and you're running things ready, and you know that on that day in that situation, now I'm going to go for a run because I know that's going to help me. Distraction kind of things. It can be a television program, a Netflix, or whatever that you watch. Something, a first aid kit that's tailored for you, that you can then rely on in the situation that's difficult, and that can be really helpful. It can be helpful to have a couple of friends on board who understand what's going on and can be consistent with you. I remember a good friend saying to me, she had a lot of difficulties with mental health problems, and she said love and truth were really important. So knowing you were loved by people who were close to you, having one or two people who you knew loved you whatever, but who also were honest with you and spoke truth to you, and would challenge you if necessary as well. That can be really helpful. I think for a lot of people some form of therapy is useful, and again, if you look online you can see what's available. The common therapies are CBT, so cognitive behaviour therapy, which is changing our thinking and our belief systems to affect our feelings and our behaviour. Then there's CAT therapy, cognitive analytic therapy, which is more about relationships, and the relationship with the therapist becomes a way of modelling relationships and things that can be helpful in that. And then we've got something called DBT, which has probably been more talked about recently, and that's particularly for women who self-harm. That's who it's recommended for at the moment, but it may be helpful for other people. And in those situations, women who self-harm, that's available on the NHS as well in most places. So it might be worth having a think about some of those therapies which are known to be helpful, and which are supported through Institute of Clinical Excellence, NICE guidelines. So definitely therapy there that's helpful. And over time, as you start to understand yourself better, as you start to understand relationships better, as you start to understand where some of these things have come from, the vast majority of people with personality disorders do get better. They learn how to manage things. They learn how to spot the triggers. And I think have great hope that there's a possibility for these things getting better. At the root, there is often, like a lot of these things around our identity, how we value ourselves, and relationships with other people. And I think that's where a lot of the work is most fruitful. And ultimately, what's really true about us? Where do we really get our value from? What does God say about us? What does He say? Actually, have we got a foundation that is separate to all the trauma and all the difficult relationships that we can rely on, that brings in that truth about who we are and how we're really, really valued? And that's really worth thinking about as well. So I'm going to stop there. I think that's long enough for this little talk. I hope that's helpful. Do check out information. I think it's a really helpful thing to start to read about and understand a little bit, because it helps us understand a lot of the issues that are out there. A lot of people struggling with these things. And, if it's for ourselves or for a friend, it's helpful to know and get help. There is so much help out there. Get some help. So yeah, hope you have a good day today, and I'm going to talk next week about words and what we speak, and some of the evidence for how our words change things. So I'll see you then.